Okay, welcome to Raaonline. I am Dr. Sudakshina, Professor of Anatomy. Today we are going to discuss a case which is related to the dural venous sinuses. So I will be reading out the case and explaining the condition and then the related anatomy with that. So a 56-year-old lady admitted in the emergency with fever, rigors, throbbing headache, unilateral bulging of right eye, and loss of vision and inability to walk, all of a sudden onset. What is the condition? Was asked in the question. Mention in detail the location, relation, tributaries, communication and clinical significance of cavernous sinus. Now let's see what is the condition. So when we talk about this condition, here we can see over here, this is the condition which is called the cavernous sinus thrombosis. Now, cavernous sinus, we will go into detail of all the dural venous sinuses, but directly you have to write that this is the cavernous venous thrombosis. Most important cause is bacterial infections which can spread from the sinuses, the teeth, the ear, nose or skin of the face. Symptom can be bulging eyeball, usually on one side of the face, and cannot move the eye in a particular direction, drooping of the eyelids, headache and vision loss. So these are the symptoms what the person is facing. Okay, the patient has come with these kind of symptoms and exactly the picture will be like this. Now let's talk about the flow of the blood in the dural venous sinuses. So we will come to each name of the dural venous sinuses. So we can see over here we have so many dural venous sinuses which are bloods. So now coming to this is the picture of the sinuses. Once we have removed it, we can see over here on the upper margin, attached margin of the falx cerebri along the sagittal sulcus, sagittal suture and even extending forwards, we have a sinus over here which is the superior sagittal sinus. Then we have a inferior sagittal sinus over here and then it forms the straight sinus, and these are the internal cerebral veins and the vein of Galen. They all join the straight sinus with the inferior sagittal sinus. They join to form the straight sinus, and you can see over here the superior sagittal sinus will continue as the right transverse, whereas the straight sinus will continue as the left transverse sinus, the other side. And this is the sigmoid sinus, so this will be paired, so it will be present on the other side, and then this is continuing as the jugular vein. Now over here you can see in the center you have the cavernous sinus, which is also very important because it is connected to the jugular vein and also the transverse sinus by petrosal sinuses. So we will be learning about the communications and tributaries of the cavernous sinus when I come to the cavernous sinus portion. Now, coming through each sinus, the superior sagittal sinus occupies the upper fixed border of the falx cerebri. So you can see over here, this is the superior sagittal sinus, this is the falx cerebri which will separate the two cerebral hemispheres, and this is